Talk a little bit more now about those measures with Professor Mary Horgan, who's a consultant in infectious diseases and the president of the Royal College of Physicians in Ireland. Thanks indeed for joining us this lunchtime. We saw there Minister Harris saying these measures were designed to protect and safeguard the population. Will they do that?
They will. The evidence so far, the best way of trying to protect the public really is social distancing. The scientific evidence, particularly from China and from South Korea, has shown that these interventions reduce the number of cases and protect the population.
A key part is this notion of social distancing, isn't it? Now we're going to see schools closed, childcare facilities closed and all of that to facilitate that, really.
Exactly. The way the virus is transmitted is by close contact. So the more we can separate and become a bit more socially isolated is how to contain the infection. And I would encourage everybody to take the recommendations of the government very seriously. We personally have a responsibility, and collectively we have a responsibility to look after the most vulnerable in our society. And while it may be mild, if I get it, it certainly would have a big impact on my mother if she got it.
So on that, with the closure of schools and childcare facilities, many people will still have to go to work and they may look to grandparents to help out with childcare. So is that something they should do or they should be cautious of?
I would say that if they don't have symptoms, their likelihood of transmission will be low. But saying that, it depends on the age and the health of a grandparent. I think this is an opportunity for us as a community to go and help each other, for parents across different families to share the parenting while people are at work, and to look at innovative ways of providing service. As you'll know, our frontline staff have been absolutely tremendous in this, the doctors, trainees, nurses, people right across healthcare in the community and in hospitals. They've been on the front line at a time of great uncertainty, and they've been there to provide care for the people who are concerned or are sick. But I would advise that those people who are sick and may be at low risk of getting the infection or have a mild condition is to phone your doctor, phone your GP in advance, get the advice there rather than going and exposing a lot of people who are sicker in a waiting room to a potential virus. So that's very important.
Now, a lot of these measures are very dramatic and people might be feeling a little bit anxious and a little bit panicked indeed today. Should they be?
No, they shouldn't be. To reiterate, the science and all the research that we know so far in this very new virus shows that these measures are really effective.
Now, while some things have been cancelled, indoor events of under 100 people are allowed to go ahead and outdoor events of under 500 people are allowed to go ahead. So people should still live their lives in that instance. Is that it? Don't be afraid.
Absolutely. Don't be afraid to go out, go walking, do things that you may not normally do. A lot of people will be at home with small children. They have the opportunity to go out and exercise with them. So don't be afraid to go out. You're not going to get it from just being outside. It really is social closeness that is the risk factor for it.
And I suppose it's important to note as well that if you do contract coronavirus, it can be quite mild for the vast majority of people.
Absolutely. Again, the evidence shows that 80% of people who get the infection, it's a mild respiratory infection. But what's important is that those people don't transmit it to the other 20% who are more at risk of a serious infection. And that's why, as a nation, this is really a collective effort. And to reiterate particularly what the Minister said, Minister Humphreys and Minister Harris, this is all our responsibility. This is Ireland as a nation caring for those who are most vulnerable.
Now, we are an island here, obviously. Do you think we should have further measures and maybe restrict those coming into Ireland at this time?
I think it's maybe too early to tell. The government and the emergency team will look at all of the best evidence and take guidance by the WHO and the European Centre for Disease Control and Prevention. And I think if we follow what's best international practice, we will be on a good road.
And as you say, keep living your life, albeit in a less crowded fashion. Thanks indeed for joining us there, Professor Mary.